It's just one day after Governor Brown sent ventilators from Oregon to New York.
Yeah, and while ventilators don't seem to be in short supply here in Oregon, there is extreme concern about hospital capacity and personal protective equipment for healthcare workers. Tonight, we're taking a closer look at how the fight to stop the spread of COVID-19 is playing out on the front lines. Our Fox 12's Kendra Kent is live tonight with an update. Kendra?
Yeah, that's right, you guys. And like you mentioned, Oregon and Washington State have sent those ventilators over to New York. And we did speak with some hospitals today that they're actually seeing record low patients at this time. However, the big issue here in the Pacific Northwest is still that personal protective gear. And as of yesterday, Oregon still has fewer than half the amount of PPE that it's requested.
The battle is far from won, but in recent days, there's been some encouraging news in the fight to stop the spread of COVID-19 in the Pacific Northwest. For starters, both Oregon and Washington leaders say social distancing is working. The Oregon Health Authority says limiting travel and social interactions has cut down infections by some 50 to 70%. That means fewer people clogging up hospitals and more room to treat the sickest patients. Providence Health and Services told Fox 12 on Sunday that all 8 of its hospitals are emptier than usual. A spokesman says that's largely due to the decision to delay elective procedures. And as of Sunday, OHSU says its hospital has 9 patients with COVID-19 and plenty of available ventilators. The good news prompted both Oregon Governor Kate Brown and Washington State Governor Jay Inslee to donate state stashes of ventilators to New York.
It was not a difficult decision. We know where we are in terms of bed capacity and ventilator capacity, and we're in, at least right now, good shape. And it made sense for us to help our neighbor out, particularly a community like New York that is just being devastated by this horrible pandemic.
But there is one area where Oregon and Washington still fall short: personal protective equipment, particularly for healthcare workers. While Providence told us it's in, quote, good shape when it comes to PPE, other hospitals are struggling. Legacy Health says it's running low on some supplies and has, quote, significantly increased usage. As a result, we have implemented conservation, reuse, and extended use procedures. Making matters worse, Governor Kate Brown's office says there's a big problem with the stockpile of PPE sent by the federal government. In particular, some supplies, like masks, are expired, recalled, or even faulty in design, making them unusable.
We are we're working really hard to be conservative with the supply that we had.
Right now, Oregon only has a fraction of the PPE it needs, and officials say they do not know when supplies will be replenished.
And Oregon's COVID-19 Joint Information Center told me today that it is hard to gauge when these supplies will come in because the supply chain is so taxed right now. Everything is running behind that they simply don't know when these shipments will arrive. Reporting live tonight from our mobile newsroom, Kendra Kent, Fox 12 Oregon.